The Bright Impression system is meant to cosmetically whiten discolored and stained teeth. Our whitening gel improves the discoloration of the teeth without changing the structure whatsoever. A light source aids in accelerating the ions in the gel, producing faster results. When used properly, the results are dramatic. Actual results may vary, but usually an improvement of between 3 to 8 shades will be achieved. Firstly, it is very important to remember that cosmetic teeth whitening must be self-administered by the client. Therefore, do not touch the client's mouth under any circumstances. Think of them as customers rather than patients. Have the customer fill out and sign the customer consent form. Treatment cannot be performed if a customer is pregnant or nursing, allergic to silicone or peroxide, or has untreated oral issues. Put on a pair of latex gloves, and if the client is allergic to latex, switch to non-latex gloves. If the client is prone to sensitive teeth, suggest alternative measures, such as a milder solution, and for after the treatment, suggest Sensodyne toothpaste or vitamin E. Help your client with the self-adhesive bib, and then hand them a fingertip brush-up. Have the client use the blue side, which is the rough side, to clean your teeth in order for best adhesion of the gel. Instruct them to brush only the teeth and to be careful not to irritate the gums while brushing. Using the shade guide, match the color of the client's teeth to a color on the shade guide. Hand the client a mirror so that they can observe their before color, and then record the before shade on the client consent form. Remove the tip from the vitamin E swab, which is marked with a red line, holding it upright so that the liquid does not pour out. Slightly tap on the side with your finger. The liquid will fill the cotton end of the swab. Hand the swab and a mirror to the client and have them run the swab along their gum line and lips for protection. If using the silicone impression mouthpiece, hand the mouthpiece to the client in the package and have them remove it. Show the client that there is silicone on top and bottom. Ask the client to slowly but firmly bite into the silicone to get a good impression. Then have them slightly rock the impression tray back and forth to create just a little space for the gel. The client will remove the tray from their mouth once the impression has been made. Using the syringe, place a small amount of the whitening gel into the front of the impression on the top and the bottom of the tray. It is important that there is enough gel to surround each tooth, but not so much that the gums are needlessly exposed to the whitening agent. Hand the client a set of protective goggles and have them sit back comfortably. If the client tends to have problems with gagging, ask them to sit up as straight as possible. Hand the client some Kleenex and a small bowl lined with paper towel in case the client salivates excessively during the procedure. Have the client place the tray into their mouth. Set the LED timer to the desired length of time. Turn the LED light on and adjust to approximately 1 to 2 inches from the client's mouth. Check with your client periodically throughout the procedure to ensure that they are comfortable at all times. You may now remove your gloves. Have a cup of water, a second brush up, as well as the bowl lined with paper towel ready for when the procedure is complete. When the time has expired, remove the LED light and ask your client to sit up and remove the mouth tray and place it into the bowl. Pass a cup of water to the client and have them swish the water and spit it into a cup or a sink if available. The client may now remove their goggles and bib. Hand them another brush up to remove any residual gel. Remove your gloves and have a mirror and shade guide ready for comparison. Record the aftershade on the client's consent form for future reference. Recommend to the client to refrain from drinking coffee, tea, red wine, etc. for at least 24 hours. Teeth will remain porous for another 24 to 48 hours. A simple rule of thumb is that anything that will stain a white t-shirt will stain your teeth. Have straws available for your client to take with them just in case. Sterilize any bowls, goggles, etc. after use with Gamut Plus and wipe down the chair and the lamp with Genie wipes available through Bright Impressions.